Welcome back to Great Day. Question: how healthy are you? How would you know if there was a problem with your heart or lungs, or if you have early stage cancer? If you're counting on symptoms to warn you, our next guests say by then it could be too late. Instead, they invite you to get an inside look at your body to spot potential problems when they're much easier to treat. Joining us with how Advanced Body Scan can save your life is Chief Medical Director Dr. Gene Henderson and radiologist Dr. Anthony Sparks. Good morning.
Good morning, Deborah.
Good morning.
All right, Dr. Sparks, let me start with you. It's interesting, whenever we get a physical, I know in years past I would go in, they'd ask me a few questions, maybe take my blood pressure, and that was it. They had no idea what was really going on inside. This is much more advanced.
Sure, yeah. Our exams are meant to be additional information that you can provide your doctor, in addition to those things that you mentioned with your physical. It's not meant to replace that, but to add to it. Coronary calcium score screening, lung cancer screening are very well recognized and widely used tests now that can add much more additional information that you may not pick up in that traditional screening that you mentioned.
Yeah, Dr. Henderson, I mentioned earlier that a lot of us show up when something is wrong, but fact of the matter is a lot of times very serious illnesses are asymptomatic.
That's correct, Deborah. We say that time is heart, and that means the earlier a diagnosis can be made and the earlier we have the opportunity to intervene and perhaps change course, the better the odds are for a favorable outcome. So detecting disease in its very early stages is critical to our success.
All right, Dr. Henderson, also, anyone should do this, but I guess especially if you have family history, it's probably much more important to do this.
Well, when we talk about things like family history, high cholesterol, diabetes, high blood pressure, things of that sort, we're talking about things that predict your risk of developing heart disease down the road. This scan is actually looking at, do I have heart disease now? Has the disease already started? Am I already in a state where aggressive intervention would be appropriate? So this is actually even more important than your risk factors, but certainly should be considered if you have multiple risk factors.
All right. And Dr. Sparks, what other things can you see with this body scan that we should pay attention to?
Sure. So there's lots of other things that we pick up besides just the coronary calcium and the lung nodules that may be a sign of cancer. Thoracic aortic aneurysm, something we often find, again, something that's not symptomatic until it's possibly something that's already too late. So we find those often. Other lung disease changes like emphysema in smokers and lots of other things as well. So the great thing is that we are targeting some specific things that we know we do a really good job at, but we end up finding a lot of other things as well that you may not have any symptoms of yet. We can fix early if we do find it.
Yeah, take us through the process here. We've seen some video, and it looks like it's, number one, it looks like it's quick and convenient. Some people will say that, oh, I get claustrophobic. You're not completely enclosed also. So talk about the technology that is used here.
Sure. So, we have a high-speed CT scanner that's kind of a donut. You lay on a table. This little motorized table takes you in and out of the donut in just a matter of a few seconds. Typically, people don't have any issues with claustrophobia. There's no needles, there's no prep or anything like that for this. It's you show up as you are. The test takes a few minutes, and you walk out and you get your results within a few days. And so it's very quick, very easy, very simple.
Yeah, and Dr. Henderson, you get your results, but you can also meet with someone to understand what those results are.
That's right. We can discuss the results with you. We'll obviously send a copy of results to your doctor as you wish. And it's very transparent. We want you to understand the results of the test and what should be done.
Yeah. Human nature, again, is to come in when something's wrong. The importance of getting in now, so at least you have a baseline of where you